Hello, and thank you for joining the Open Enrollment webinar for Corbett Preparatory School of IDS. Your open enrollment is scheduled to begin on February 18th and will run through Friday, February 22nd. The elections you make during this annual open enrollment will be in place from April 1st, 2019 through March 31st, 2020. We would like to welcome our 27 member institutions to this year's 17th annual ICUBA Open Enrollment. We're very excited to be able to present this information to you, and we hope you find it helpful. Some things we're going to talk about. We're going to review enrollment and eligibility, some perks that ICUBA offers, and your 2019 benefit plans. First up, enrolling in your ICUBA benefits at icubabenefits.org. During this open enrollment period, you're free to update your benefits, however, will best fit your needs. These updates will be for the plan year April 1st, 2019 to March 31st, 2020. Your open enrollment elections will remain in effect for the full plan year unless you have what we can call a qualified life event. If you get married or have a baby or one of those other life events this year, you do have up to 30 days to make updates to your elections. But for this open enrollment period, you will log into icubabenefits.org, and at the top of your screen, you will click the orange Start Your Enrollment button. Emma is available this year as well. She is our decision support tool, and she can help you make some decisions if you're not sure about which plan, or if you have questions about what a deductible is. She has some really good estimates and some estimating tools and stuff like that. So she can, she's in the top left-hand corner of your enrollment screen. So if you shut her off at the beginning, you can always go back into that corner and reactivate her and just do the walkthrough with her. She is available in English and Spanish. Who's eligible for the ICUBA benefits plan? Legally recognized spouse, natural child, legally adopted child, stepchild, a child covered by a qualified medical child support order, a child that you have legal guardianship of who resides with you, and foster child. ICUBA's plan is very unique in the fact that we cover dependent children who turn 26 until the end of the year in which that age of 26 is attained. So if you have a dependent that's turning 26 in January, February, or March, they are still eligible to be enrolled in our plan effective April 1st. We'll just send you a reminder closer to the end of the year that it's time to find their own coverage. I believe that everyone always reads the fine print before they click the final I agree button, but if you should miss this paragraph before you complete your enrollment, you are certifying that all dependents that you are enrolling in your coverage meet the requirements outlined on the prior slide. We are offering another open enrollment sweepstakes this year. So just for logging into icubabenefits.org and updating your personal phone number and personal email address and stepping through our enrollment process, you'll be automatically entered to win. The two key items that you really must pay attention to and update are that phone number and email address so we can contact you and let you know that you're the winner. This is just a reminder about that single sign-on section that we offer at icubabenefits.org. In the middle of your home screen under My Carrier Accounts, we offer links to all of our brand partners. These links can get you in to order new ID cards, review your benefits, check out those explanation of benefits. If you go to the doctor, you can always double check that your claims are paid correctly, and you can do a lot of cool stuff on these sites. So just a reminder that My Carrier Accounts is in the middle of your home screen. Some medical plan perks that are offered through ICUBA's membership. We have a new benefit this year called Surgery Plus, so we will give you some information about that new benefit in great detail. We're also going to review a few and highlight a few perks that are already in place: Teledoc, ICUBA Cares, Pharmacist Advocate Program, and Blue Rewards powered by Rally. Surgery Plus is that new benefit. We're really excited to roll this benefit out. It's effective April 1st, 2019, and will be paired with the medical plan. So if you make an election for an ICUBA medical plan, this benefit is made to supplement that medical plan. What we gain through our partnership with Surgery Plus is access to their Certified Surgeons of Excellence network. These network participants are licensed, board certified, they've completed a fellowship, and they have proven lower complication rates. Surgery Plus covers hundreds of medically necessary, non-emergent planned surgeries, including some of the body parts that are listed here. For instance, if you need a knee replacement this coming year, that is a perfect reason to call Surgery Plus. Surgery Plus brings their full concierge team for the benefit of iCuba members. This is to improve the member experience and make sure that you really get the full service out of this new benefit that we're offering. With this full concierge service, if you choose to go through Surgery Plus for one of those non-emergent but medically necessary surgeries this coming year, Surgery Plus can waive your coinsurance and deductible for that surgical procedure. The Surgery Plus team will locate the 3 top surgeons that best fit your surgical needs. They will provide you with a brief bio on the top 3 surgeons for your service, and then you can have the ability to choose from those 3 that they provide to you. From there, after you choose a surgeon, the concierge team will schedule all of your appointments and manage your logistics, and they can coordinate everything from start to finish, including record transfers from your current physician to your surgeon, and they will also ensure that follow-up care is handled to your member satisfaction. The length of the first call to get you established in their system and get some preliminary information is approximately 4 minutes. And then the estimated time to their average procedure is approximately 35 days. So this is a surgery that you know that you need. It is medically necessary, but something that can be planned out in the future. Teladoc is a current benefit. This is a very popular benefit among our members. This is just a reminder that you can seek Teladoc services for only $5. The single sign-on is available through My Health Toolkit, and this allows you to have telephonic or video consultations with a doctor. You can access this benefit 24 hours a day, 7 days a week, 365 days a year. We encourage everyone to register for this benefit in advance. You're going to have to complete some questions like you would visiting any other doctor's office, some general medical history and stuff like that. So if you have not already, we really encourage you to get in there and register for Teladoc. If it comes up, the company ID is iCuba, and they can be reached at 1-800-TELEDOC. Some reasons you might call Teladoc are the more mild symptoms like sinus problems, pink eye, allergies, flu, nasal congestion, some of those more mild ailments. So the doctors are able to write minor prescriptions, of course, no controlled substances, but if you need some Tamiflu, if you have the flu, or you need some eye drops for some pink eye, those are some of the things that they can help you with. This benefit is meant to supplement a relationship with a primary care physician, so it's still important that you maintain that relationship, but this is a good alternative to urgent care. You can also add your primary care physician's information in the Teladoc site, and that way they can share the information with your primary care so they can keep a full overlook of your total well-being. This is a reminder slide about iCuba Cares, their pharmacist advocate program. These are real pharmacists that can really advocate for you. They'll get on the phone with your doctors and with the Optum insurance company to really help you get the most out of your prescription benefits. And they really provide real solutions to many of our members. We encourage everyone to at least call for what we call a prescription checkup. This is where a pharmacist can sit and help you evaluate the current medications that you're on, talk to you about those different tiers that we have, and make sure that you're taking the right medications. If you ever run into any situations with a prior authorization, step therapy, or quantity limit, that's a great time to call iCuba Cares. iCuba Cares is available Monday through Friday from 9 to 5. The Blue Rewards Powered by Rally 2019-2020 Incentive Plan is not changing very much from last year. All covered employees and covered spouses still have the ability to earn up to $250. We have added a few incentive options as it relates to the coins this year. The Rally survey is still going to be our gatekeeper. That means after April 1st, when you log into Rally from a computer, you'll be prompted to complete that survey. That survey must be completed before you gain access to that $250. So the gatekeeper is really the most important thing after April. We've upped the coins for that survey to 400 coins, and you'll also be eligible for the IQUBA private sweepstakes. We've also added a few coin options, Teledoc registration, and if you've already registered for Teledoc in the past, you will still be awarded those 400 coins at the start of the new plan year. We've also added tobacco attestation and clinical rewards. The clinical rewards program targets chronic conditions. If you have one of the conditions listed on the screen here, you may see a difference on your Rally home screen. What this difference is providing is just a little bit of member education regarding your chronic condition. You may see some articles, some reading material, or they might encourage you to contact a health coach. This clinical rewards program sets up some goals for you each quarter, and if you reach all of those goals, then you will be awarded 500 Rally coins, or up to 2,000 Rally coins each year. The private sweepstakes were really popular last year. Everyone loves getting the phone call that they're the winner, but we are still hosting those private sweepstakes for the survey, city challenges, and entering those missions. City challenges were the most popular last year because they have the largest incentive win with that $50 Amazon incentive. We are still giving away those gift cards every 14 days. So if you are checking into those challenges and hitting those milestones, every single time you hit a milestone, you're entered in to win one of these $50 Amazon incentives. Your core benefits are the medical, prescription drug, and behavioral health, and these are all strategically paired for the best-in-class service to our members. Just by electing IQUBA's medical plan, you receive the benefit from all three of these brand partners. Blue Cross Blue Shield of Florida provides our medical, OptumRx provides our prescription drugs, and Aetna provides our behavioral health benefits. We want you to get the care you need. So this is just a brief overview of where you should go in what situation. Everyone should always make sure that they maintain a relationship with their primary care office. This this should be your first stop for everyday health services, including an annual checkup, health screenings, common illnesses, and disease management. And then in the middle, this is where you go when you're on the go. So Teledoc Convenient Care, which is the CVS Minute Clinic or the Walgreens Take Care Clinic, or just your general urgent care. This is for everyday health concerns when your PCP is maybe not available or it's not in a convenient time. So these are for those more mild illnesses, sinus problems, bronchitis, ear infections, nasal congestion, some of those other things that we talked about on the Teledoc slide. We do want you to be mindful of pop-up ER clinics, which are made to look like urgent care. We just don't want you to be surprised when you're hit with a $300 copay when you're expecting a $30 copay. So we encourage you to check the provider website and make sure that your local urgent care is really what we would consider an urgent care and not one of these pop-up emergency room clinics. Of course, in red on the far right side, we want you to visit the emergency room if you're ever needing some life-threatening help. So if you're ever having chest pains, major traumas, severe burns, symptoms of a stroke or heart attack, these are the times that we strongly encourage you to visit the emergency room. But again, only for those life-threatening, more severe in nature health concerns. Blue Cross Blue Shield has stepped up their game when it comes to customer service. They've implemented a new customer service team, which they call Care Connected. So if you call during normal business hours, this team, which is specifically trained in IQUBA's benefits, is available to assist. They've installed some new technology behind the scenes, so if you call during those normal business hours, your ID number will actually route you, if they're available, to the same advocate that previously helped you. This is to prevent you from having to re-explain your situation every time if you're working on an ongoing claims issue or you're trying to get to the bottom of something. This team also can help you with lifestyle coaching and really provides that higher level of assistance. It is a new service with the same phone number. So this is the same phone number that's listed as your customer service on the back of your Blue Cross card. Blue Distinction Total Care is still free, so if you visit a family practice, internal medicine, or pediatrician's office with this Blue Distinction Total Care designation, all medically necessary services performed in their office are always free. So if you're in the market for a new PCP, check out My Health Toolkit FL through our single sign-on section, and make sure that you filter by this designation, and once you have one of these superior physicians, you are good to go. Corbett's two plan offerings are the Preferred PPO and the Premier Copay Plan. I do want to call attention to you in blue at the top. The deductible and out-of-pocket are increasing slightly this year. The individual deductible and out-of-pocket will be increasing by $500, and the family deductible and out-of-pocket will be increasing by $1,000. All other benefits will remain the same as prior years. The differences in these two plans really come down to a co-insurance versus a copay. So the freedom of choice is really yours. The prior slide indicated all the similarities between the two plans, and this slide really highlights the differences. As you can see on the left, the Preferred PPO plan is set up with more of that co-insurance structure, with that 20% co-insurance, while the Premier Copay plan has that flat copay associated with certain office visits. So make sure that you're reviewing the plans carefully and choose which makes your life the easiest. With the increase in deductible, we want to let you know that many of the services that you receive every day are not subject to the deductible. So when you're going into the physician, you need to brace yourself with the power to know how your benefits work. So just understand that if you're going in for an annual checkup to see a specialist like a cardiologist or a neurologist, or you're going in for a common illness or the common cold, getting any of those emergency transportation, physical therapy or occupational therapy, a physical, any urgent care visits, all of these items, including prescription drugs and any lab work that you get done at Quest, none of these items are subject to the deductible. So just make sure that you are equipped with this knowledge when you're visiting the doctor's office. Where that deductible increase is going to matter is on these major services. So if you are visiting, if you have an overnight stay in a hospital, if you're expecting a new baby, if you need to get new hearing aids, or you need to seek treatment in skilled nursing rehab or an inpatient mental stay, all of these items are subject to that deductible before you can seek these treatments. So this is where you really want to maximize your use of the Know Before You Go tools that are available on Blue Cross's website. You can always search, like if you need an x-ray, for instance, you can always get on the website and search for the best place to obtain that website. If your doctor tells you to go to the local hospital, that's probably going to cost you a lot more money than if you locate an imaging center that's down the street. The IQVIA prescription drug plan is remaining the same this year. What I will call to your attention on this slide is the 90-day supply saving you some money. So you can always visit a retail location and get a preferred generic, for instance, for $5. But if your drug is available in a 90-day supply, if it's more of a maintenance medication, we always encourage you to seek a 90-day supply, so a 3-month supply for the cost of 2 months. We also want to remind you about the prescription drug freebies. If you're a diabetic, any prescribed diabetic supplies can be free through your Optum benefits. Also, aspirin for adults, generic folic acid, and generic prenatal vitamins for pregnancy. And if you're eligible, those prescribed generic statins can also be free. OptumRx stepped up their customer service game last year, but they do have a few enhancements to their digital member portal. So you can access this portal through the single sign-on section at IQVIAbenefits.org. You can access and update your mail order, manage your prescriptions, find local pharmacies, and even set reminders for when you should take your medicine. So if you've not been to the new Optum website, please visit it through our single sign-on section and check it out. Behavioral health and substance abuse benefits are available through our partnership with Aetna. So if you're seeking professional counseling or you need a psychiatric medication evaluation, you're dealing with applied behavioral analysis therapy or need autism benefits, or you're seeking more of those intensive services like hospitalization, detoxification, or residential treatments, all of these behavioral health items are going to be with the Aetna program. Condition management is also free. These are free weekly sessions over the course of an 8-week period. This includes 16 sessions to you for free. These sessions are identified with the health and life symptoms and outlined on your screen. So diabetes, depression, pain management, postpartum depression, grief and loss, all of these items can fall into this Able To program. How this works is you can meet once a week with a therapist and once a week with a behavioral coach, and they will really set up some goals and some lifestyle changes to help you cope with these health and life situations. Aetna also provides our employee assistance program through Resources for Living. This is to help you take control of your overall emotional well-being. It is the same phone number on the back of your Aetna card. Option 1 is for the EAP, and then option 2 is for behavioral health. They also have several mobile apps that you can download just to try to gain a little insight to that emotional well-being. The Employee Assistance Program is available to everybody at Corbett Prep. This benefit, you do not need to be enrolled in IQBA's benefit plan or even be benefits eligible. You simply have to be an employee at Corbett. So this benefit is also available to you and all members of your household, and including dependents out of the household up to the age of 26. Through the Employee Assistance Program, you can seek services for emotional support, life, legal, or financial counseling or services, and this is 6 sessions per issue per year. So if you need some emotional support, you can call and get set up for 6 sessions for that emotional or life support. And then with tax season coming up, if you need some financial support or some financial consulting, that's 6 completely different sessions. So it's 6 sessions per issue per year. The phone number is listed for this on the screen, and every call made to Resources for Living is free and confidential. New this year, Resources for Living is partnering with Talkspace, and now you can text your therapist. On average, 1 week of stock Talkspace messaging is equal to 1 EAP session. So you are able to send unlimited multimedia messages via text, audio messages, pictures, videos, etc. To your therapist via a web browser or the mobile app. This is not the instant gratification that you get from text messaging a friend, but this is another way for you to take control of that mental health care. The therapist does have one business day to respond back to you. So just keep in mind that it's not that instant back and forth. There is an authorization process in place. The first step is you must call Resources for Living for authorization, and they can walk you through downloading the app and registering in Talkspace just to get this benefit set up. I will caution you that this benefit is only available to adults who are 18 or older. These are your monthly medical plan premiums, and these will also be built into our IQBAbenefits.org enrollment site. The iMed Vision plans are not changing for the coming year. You still have the choice between the base plan and the buy-up plan. The base plan offers new frames once every 24 months and a $100 allowance for frames or contact lenses, while the buy-up plan offers frames once every 12 months with a $130 allowance for frames or contact lenses. These are your monthly vision premiums, and these are also programmed in at IQBAbenefits.org. This is just one slide to capture all of the mobile apps that we've touched on throughout the presentation. And what I would like to highlight in the top corner is the new Blue Cross Blue Shield app. If you've not already done so, please log into your app store and locate the My Health Toolkit mobile app This is a great tool to keep in your pocket so you have the medical plan benefits with you at all times. You can access your claims, you can review your benefits, you can locate providers, and you have your medical ID card in your phone with you at the touch of a button. So if you haven't already done so, these are really great resources to keep with you. Thank you for your attention, and we are glad that you have stuck around this far. Enjoy your open enrollment period, and please contact us if you have any questions. Thank you. Bye.